This film is designed as a refresher on the teaching you've been given on attaching a catheter night bag. If you'd like some further training, please contact your hospital or community teams.
The equipment should be arranged on a clean surface and within easy reach. Wash hands. If you'd like some top tips on hand washing technique, please watch our hand washing film in this series. If you prefer, you can start by emptying the contents of your day leg bag by opening the valve over the toilet. But please decontaminate your hands afterwards. Sit comfortably with your equipment nearby. Use a sterile wipe to clean inside of the drainage tubing. Allow to dry for 30 seconds. Open the packaging of the new sterile catheter and check the drainage tap is closed. Remove the protective cap from the tip of the tubing, being careful not to touch the connector. Hold the tap of your current leg drainage bag in one hand. Insert the tip of the new night drainage bag into the funneled end of the leg bag. Place the night drainage bag onto a stand or in a bowl to keep it off the floor, but place below the level of your bladder. Now open the drainage tap of the smaller leg bag so that the urine can flow through the small bag into the larger night drainage bag. Never let your catheter be pulled by the drainage bags. Always secure at the thigh. Dispose of packaging in the bin. Wash hands. Please contact your hospital team if any of the following occur: no urinary drainage, abdominal pain, or strong smelling urine.